Powered by Scott Tree Services.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. Every week we congregate with friends and other coworkers, collaborators around the community to bring you conversations that we hope help your life just a little bit. Maybe they're entertaining as opposed to any educational value. But whatever the reason, we're awfully glad you're here with us today. My guest today is my good friend Peggy. She is the executive director of the Alzheimer and Parkinson's Association of Indian River County. And I didn't even have to be prompted because we've done this so many times over the last, 10 years or thereabouts. So always happy to have you here. We always have interesting things to talk about as America and Indian River County grays, G-R-A-Y.
Right.
Yeah.
That's true. We are. We're aging, and here we are.
That's right. Ta-da-ta-da.
Awesome aging.
Yeah, well, William had to stop us because we were having such a good time talking about things that are going on scientifically and not, that
he
had to say, are you guys ready? So we just carried the conversation on.
Right, right. So, yes, that's one of the things that our organization, as you know, we are here to help these families who are, memory disorders and movement disorders. They are just so common, and they do hit after the age of 65 most of the time. And so we are here, we started as a support group back in 1982.
And you're still supporting all of us.
Yes, we are. We are. Now we have 18 support groups. But we we started off, a woman who had a husband with Alzheimer and a woman who had a husband with Parkinson's found each other through an ad in the paper because there weren't any support groups. So that, they started meeting, and then they divided into 2 support groups. And by 1986, they became a 501c3, the Alzheimer and Parkinson Support Group. And that's how they actually kept going, and they would find spots. Any church would give them places to meet, and they would get together for a brown bag lunch, and they'd have Sam Block or Dr. Schaefer or somebody come in and talk. And they realized somewhere around 2007, 2008 that there was more to be done, and they found the Johns Island Foundation, and they found John and Joy Stagels, and they built out the 4,000 square foot space that we have right now in what was the old doctor's clinic. And so we've just been developing programs since then. We now have 46 programs, and they're all free of charge. Oh, I know.
46. So 46. You must have a lot of volunteers that help with that.
We have volunteers. What we've done over the years, as we see a program works, like the social respite program, and we started with volunteers, but then you find out you have to stabilize that with paid staff. And so that's how we did that, and that's how we built. And we've done that with a lot of our programs, our movement programs. So we basically serve 2 different parts of the community.
Okay.
We are there for families who are trying to manage the care of someone with dementia. That's 3 times harder than any other type of caregiving. My mother had Lou Gehrig's disease, but she still had her cognitive. It's not easy, but she still had her cognitive, and she ruled from her pillow. Yeah. She ruled from her pillow. I had a
grandfather just like that.
Yeah, exactly. And so but if you are losing someone to a memory disorder, some form of dementia, you are losing that person emotionally, you're losing them socially, it affects every part of your life, financially. And so the caregiver is under so much stress. And so that's what our organization began. When you walk in the door, our everything we do, how we greet you, how we talk with you, how do we make you feel? It's just that simple. How do we make you feel?
Well, you make it simple, but the reality is that if you are dealing with someone and they ask for the 4th time after breakfast, when are we having breakfast?
Right.
It's really hard not to be reactive, and yet you have given out so many tips about distraction and, taking deep breaths.
Right.
Whatever gets you through that moment, because they're not doing it on purpose.
No, it's like improv. We were discussing earlier before the show, the first thing you do if somebody looks at you and says, I have to find my mother, your answer is, you have to find your mother. You say it right back to them. The easiest way for us to explain it is that our brain has to give us answers. And it's going to do that based on, no matter what, it's going to do that, right or wrong. And it does that through the data that your senses send it, but also through your emotions. And so your emotions are filtered through the cognitive parts of your brain, your judgment, your memory, your reasoning, your context of time, place, person, your self-awareness. So all of these things go in to filter those emotions. So if somebody said, Peggy, you have to go on a camera and a microphone, and I go, I don't want to do that. And my brain's going to say that, yes, you are. Indeed, you are. And so, but when that cognitive starts to disappear, so does the filter. So that's why we tell everybody, your goal with someone with dementia isn't to reason them back and to correct them.
It's not going to happen.
And it's not going to happen. You can't expect the brain to reason if it can't. And so all your goal is positive emotions. That's all you want. So you agree with them, and then you use therapeutic fibbing, and you just reassure them, and then you just, give them a compliment, love what you're wearing, or you've got the best smile, or your eyes are so good, or everybody thinks you're the best dresser. And so that's the goal. And if
so
that's
it's sort of like dealing with a toddler.
Oh, yeah.
But you don't have to worry about you're spoiling them for a lifetime.
Exactly, because they aren't going to learn. And the thing to remember, though, is that the toddler has toddler's emotions. This person has adult emotions. So that's more complex. That's more deeply ingrained. And so it can be set off like that. And, it's very much like improv, but you have to constantly keep yourself up, so you can keep them up. And that
is wearing.
That is so wearing. Yeah. That is so wearing. We teach a class called Stress Busters. It's our longest class, as you might imagine. It's 9 weeks. But it's all these different little tools and strategies to help you understand when you're getting stressed and, different techniques. You try them on, like shoes. What fits me.
So that is separate from working as a caregiver. That is open to everyone?
Oh, yeah. All of our classes are open. Yes, absolutely. Okay. Absolutely. Okay. Because, stress is going to come through at every time. And anything we can do for the community to, for example, we have a class called Total Memory Workout. It's for people who still have all their cognitive, but they want to keep it sharp. They don't let me teach it anymore. I don't get to teach it. But apparently I'm not using the tools. But it's great. It's different things so that you can mindfully keep your memory sharp. And the same thing with Stress Busters. You can mindfully manage it better if you have some of those tools. And sometimes it's just being aware of yourself.
I was going to say, I'm thinking back to the work environment I just left, and we have joyfully embraced the Epic software in our organization as of 1 week ago. And so stress is like the word of the day, because people are trying so hard to do what they used to do to take care of patients, but in an entirely different way. So I'm thinking maybe I should have you come over and just
teach a Stress Busters class. It's true. It's just amazing. And we pile it on ourselves, and we're all moving so fast now.
Because there's so much information coming out, and we want to grasp it, but, we just have this one-size brain.
I know. And then our phone is always right here, right? Yeah. And we're just used to it, and so I think a lot of it is, you stop, you take a breath. When the caregivers come into our place, their hair's on fire. And that's one of the reasons we love being able to get the word out. Come across our threshold earlier, and we can help you with the tools. Is anything going to be perfect? No. Is it always going to work 100% of the time? No.
But you have great laughs over there.
Yeah,
you always do the positive.
We do. We have and that's the whole thing is you create an environment that's upbeat. And when your patience runs out, you have your support group. You've got somebody else there that can take over for you. And if you watch Roger at our social respite program, for 6 hours, he's bouncing along with a room full of folks with dementia. And I think the last I heard this morning was they were talking about George Clooney. And, it doesn't have to make sense. It just has to be fun. Shallow, fun-loving conversation is where they can thrive. That's all you have to ask of them.
So before we take a break, I want you to continue on with a little more information about the social respite.
Okay. Right. So our social respite is activities-based. It's not a medical setting. We can't do hands-on. We don't give out medicines, but it's just activities, and it's an environment of fun and laughter. So they come
safety.
in and safety, yes. And they come in at 9 o'clock. They bring their own lunch, and at lunchtime we serve it to them individually. And
peanut butter and jelly,
whatever they bring. I tell you, some of them have much better lunches than I do.
Oh.
And so, but it starts off with social time, and then there's some chair exercise, and then there's games, and then there's old time TVs, and then there's all different activities. We have the museum comes in and does art projects. We have the VNA comes in and does musical therapy with us. We have pet therapy coming in. It's just fun. So you go back in there, and that's what's nice. I can go from my office to there and just go and just, laugh and twirl or dance, whatever they're doing. And it's just fun.
So is there a diagnosis, or what are the entry criteria? Because I want to come, and I don't think I qualify yet.
The entry is that you do have some form of dementia, but in our case, because it's only staffed with someone who is leading the group, and then usually a volunteer or two helping. So for our program, they have to be physically independent for safety purposes. And
so they need to be able to go to the bathroom by themselves, come back.
Right.
Okay.
They can't be living independently because the purpose is that this is actually for caregivers.
Right.
And they can't be driving. And we established that policy because we just think that's a good policy. And after that, if they, obviously we try to work with them as they're getting used to the program and getting used to our environment. So if they are exit seeking, generally we can work through that until they get used to it. And then they're just happy. And that's one of the things about it. They're happy. And that's the goal.
And I think that is absolutely terrific. I'm glad that you kind of recap, because I know that that's a solid program you've had in existence for years.
Yeah,
plural.
And in a few different locations, so that's nice. Yeah.
And yet I want to give a plug for the Senior Collaborative, because they have started a program for those of us that are not yet diagnosed, but may be lonely and want someplace where they can visit and have fun and laughter and connect.
Yes.
So again, if that suits you or a neighbor or a friend, give the Senior Collaborative of Indian River County a call, because they are doing a program called Upslide, which is very similar, and it's free. So got nothing to lose.
And everything to gain from connecting.
Absolutely.
Everything.
So we're going to take a short break for a word from our sponsors, and then we'll be right back. Stay with us. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Bollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Family owned and operated since 1991. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Ooh, have a sunshine day. Sunshine.
And welcome back to Community Conversations. If you're just joining us, I'm Vicki Soule, and Community Conversations comes on every weekend so that you can hear our conversations about things going on, items of interest, hopefully things that help you live a better life. And today I have Peggy with me from the Alzheimer and Parkinson's Association of Indian River County. And I say that because I know that there is a mother organization, but you are...
We are not related to the national organization, and we always have to educate the community about that. We are grassroots, born of Indian River County, and since all of our operating income is through the philanthropy of this county, we want to make sure they understand we serve Indian River County, and all of our programs are free of charge. So,
do you keep track of how many unduplicated individuals you see every year?
We do. Last year we're just under 4,000. I think it was 30. Well, it was 35, something like that, unduplicated. But the duplicated is up to like 13,000. So how many times they cross our threshold? So what we want to do, obviously, is to widen that and letting
with
people
48
know.
programs.
Well,
yes.
yeah, and because there's so much that we can still do, and the education is becoming important. That dementia experience that we take out and take to businesses and to the facilities, that we take it to the hospital, we take to any churches, neighborhoods, and we put you through a dementia experience, and then we ask you, how did that make you feel? And then we can teach you. It's about the emotions. And that's how you approach someone with dementia. It's scary if you don't know how to approach somebody with dementia.
Absolutely. And it's scary to think
and
that,
isolating.
Yeah, to think that you are affecting people in not a very positive way, but like everything else, we have to learn.
We have to learn.
So
that's correct.
If someone was interested in having their business employees learn more through your dementia experience?
Absolutely. They just have to call us, and the way we can deliver this program in any fashion. We can do it in a classroom and just have a few people go through it, but the whole classroom is observing so that we can teach them within the class time. We can do it virtually. We've done it virtually with family members who are all over the
wonderful
country. Yes, it's really interesting. But mostly we use the RV that we got through the Impact 100 grant, and we take it
God
to...
bless those women.
Yes, I know. It's wonderful. And we take it to, let's say, a facility, and the families can come through, and we put them through an experience. We put equipment on them, and we can put them through an experience. And then how did it feel when these tasks we gave you that were a 7-year-old task, you couldn't do it? And you hear it's angry, confused, upset, depressed. And so that way we can start to talk about how it feels and how important that is.
Well, I'm really glad that you said that you're willing to train whole families, because oftentimes the children, multiple children, are responsible for a parent or both parents. And so that communication between siblings sometimes gets fraught with anger and frustration itself.
It does, and we'll do Zooms with family members all over and just talk through that because they do all have to get on the same page. The other thing that we've had, which is really interesting, somebody's friends will call and they want to be taught together. How can they help her take care of her spouse? and what can we
Wonderful.
do, and what do you do when you take him out?
Okay, and it's free. So
Oh yeah.
all they have to do is call,
All they have
and
to do
you'll
is
set up
call.
a time and date.
Yes,
Wonderful.
absolutely.
So now, another one of your programs that you have done for quite a while, but we haven't talked about lately, has to do with more emergency response. You want to talk
Correct.
about that?
Absolutely. We have a program for those at risk of wandering. So this covers those with dementia, which about 60% of people with dementia will have a wandering issue or a wandering experience. We also put this on autistic children. And we have this program with the sheriff's office, excuse me, and it's a device that puts out a radio frequency, and it's individualized, like a low jack. And so we put it on, and we teach the caregiver how to check it every day to make sure that the battery is working. We change the battery every 2 months. And if that person goes missing, it's not GPS. The first thing they do, they can look in the house, but then they call 911. The sheriff and the Indian River Shores also has the receivers. They have the receivers. They have all the information, access to the database that we've put together, which is 5 pages of information, their picture, their frequency number, and they can find them in 30 minutes.
Oh, that's wonderful.
So it is wonderful.
Yeah.
And there are so many times that we hear about these stories and we think, if they'd only been able to put that on them.
Yeah. I just talked to a friend whose mother lives in another state, lost her husband just this past year, elderly, doesn't want to give up driving.
Right.
So they put a tracker on her car. Well, she found the tracker and took it off.
Oh, yeah.
So the children are concerned.
Yes.
And I think that's probably more frequent than not.
It's extremely frequent. We find more and more that families are trying to grapple with that, and the driving is that's a huge issue.
It is.
And
it's your independence. I'd be really reluctant to give it up.
Absolutely.
And we have free buses here.
And I know that wonderful transportation.
Yeah.
But most people think an end of life conversation is easier than an end of driving conversation, and we found that true too with my in-laws. It's the hardest one.
So could someone that was in those in-between stages where their children had concern, could they still get the project tracker that you have?
They could. I think if somebody is still driving, I would use the GPS. The GPS allows the family to find them.
Okay.
This program can only
involve law enforcement.
It's search and rescue.
Okay.
Plain and simple.
Okay.
So, but I would definitely do the GPS with anyone.
And then you also still have the in-house alerts.
We don't. We have Senior Resource and VNA both had.
Okay.
One had one for falling. And,
Sorry.
But those are the things that you want to think about. Families. We talk with families about cameras in the house and things like that. If they're living alone and it's that transition time.
And again, there's a lot of organizations that deliver those services. So again, the Senior Resource Association and the Senior Collaborative of Indian River County are great references for that.
They are. They can call these numbers, and we all refer to each other. And I think this community is so blessed to have this kind of help.
And thank you for all that you do, educating us with grace and passion and laughter. We really appreciate that.
Thanks.
So next week we will have another local guest, and I encourage you to come back at 4:30 on Saturday, and I understand maybe 4:30 on Sunday as well. We always have something new and different going on in our community, and happy to share with the individuals that are making it happen. So I wish you a wonderful evening, and be safe out there. Take care.